this is Sarah Bodley, and today I'm going to talk to you about the facilitation technique of creative arts therapy. I am actually really excited because it's such an interesting topic, and there's so much we can learn from art therapy that we might not be familiar with in the first place. So I just have some goals for you guys for what I want you to get out of this presentation. I want you to know what the definition of art therapy is. We're going to identify different forms of art therapy. We're going to identify how we can apply art therapy to therapeutic recreation and what type of education is necessary for art therapy. And I want you guys to become just a little bit familiar / just become aware of the AATA, which is also known as the American Art Therapy Association. So I hope you guys enjoy. Art therapy is a form of psychotherapy involving the encouragement of free self-expression through painting, drawing, or modeling, and it is used as a remedial activity or an aid to diagnosis. Activities such as art, music, dance, or exercise are used as tools to help a patient who might need help physically, socially, mentally, and emotionally to help them reach their full potential. There's this little excerpt on this website. It's called goodtherapy.org. It's talking about art therapy, and I think it's just a really good paragraph as to what art therapy is. It says, it can be difficult to open up to a complete stranger about your deepest and darkest emotions. Sometimes we are taught to suppress our emotions and put on a blank face, even when we are experiencing inner turmoil. In art therapy, words are not always necessary. A mere lump of clay or a blank canvas can be far less threatening than giving voice to painful feelings, words, or images. The simple act of a scribble on a paper can likely bring light to darkness, ignite conversation, or be a release for a depressing thought. Because something cannot be heard by the human ear does not mean that nothing is being said or revealed. Art therapy supports our process when words are not enough. Art therapy can be used in so many ways, and there is this YouTube video, and there's a link right there. It is about this man. He is older. He's a part of the geriatric population. He has a form of dementia, if I remember right, where he doesn't engage in conversation. But when he is able to listen to music, this whole new side of him is exposed, and he is just a whole different person. I highly recommend it. It's a heartwarming video, and it makes you just so happy for this man, and I think it's awesome. So yeah, just take the time to watch that. It's just a couple minutes, and it's a feel good video, so why not watch it? And some other experiences with art therapy. Well, I'm going to focus on music therapy for just a little bit longer. This girl that I worked with a few years ago, her sister-in-law is a music therapist, and she shared the story with me that her sister-in-law was going along in this retirement facility doing her therapy sessions, and she came to notice that with one of these clients, the client was not able to speak, not be able to carry on a conversation due to a stroke that they had, but the client was able to sing just fine, which is so interesting. They couldn't speak just verbal communication, but they could see words, and it was clear. You could understand what they were saying. And then, so a music therapist just kept working with them, and singing with them, and eventually, at the end of the story, the client is able to ask, "What is your name?" Just without singing. And I think it's amazing. The power of music is just so unreal, and I don't think people realize how powerful it is and how powerful it could be. So, yeah, that's another really cool story that happened. And another huge intervention with art therapy, it helps with those struggling with depression. Depression, it's a very dark and sad place to be, and when your client is experiencing that, they don't want to share with you what is going on. They're like, what's the point? Why do you care? It doesn't matter. And so allowing them to use art therapy, be it music or painting or creative writing for that matter, it gives them a channel of expression that wasn't there before, and it helps them relieve or release some of those feelings that they might have or project those feelings, and it helps them. It's so therapeutic. And I found this really cool it's a 14-week art therapy program for at-risk youth, and it's a research study that I found, and just the results from that indicated significant increases for resilience, social and emotional functioning, and it indicated that male students had an overall stronger improvement relative to female students, which is kind of interesting. And the sociocultural implications, those were increased as well. So I thought that was cool. And this other one's even better. So the role of art therapy in counterterrorism. Who would have thought of that? It's just this really cool research paper that I found through the BYU Idaho Library, and it talks about these art therapists come in with incarcerated individuals for terrorist activities. They are presented treatment and reconstruction of extreme ideology through art production. And they found that if the art therapy program was successful, it helps. Let me see here. I'm sorry, I can't find it. It just basically implies that art therapy is very helpful in counterterrorism, which who would have thought? I think that is so cool. It also helps with trauma patients with art therapy, and then sorry. On to research, and I've already kind of addressed some things, but just some more examples as to how important art therapy really is. And so it can help with coping techniques for those with breast cancer or those with burnout. And if you don't know what burnout is, it's basically the geriatric community is just kind of, they're tired. They might be tired of living. They just don't care. They don't want to participate. So going back to the breast cancer, there was a study given out. It was 5 sessions over 5 weeks, and the clients in a follow-up study, they showed significant lower ratings of depression, anxiety, and somatic symptoms, and less general symptoms were reported for these clients. So the long-term effect based off of art therapy for breast cancer survivors is very significant, which I think is really cool. And for burnout patients, it just shows like, there's evidence that art therapy helps them not experience that burnout feeling. Makes them feel like they still have purpose and they still have a sense of wanting to continue to live. And I already kind of addressed the depression. And there was a study given about the increased overall well-being of stroke patients, which I thought that was really cool. And this is like art therapy as in painting and drawing, not music therapy, kind of like what we talked about earlier, but this is art therapy. This is just the painting. And excuse me. So it's just, and we already addressed that, but it just talks about how their just their sense of well-being is significantly increased compared to what it could be if they chose not to participate in art therapy. Something I did not know before this presentation was that there is such thing as a creative arts therapist. There's a difference between the CTRS and the creative arts therapist, which I think that's pretty cool. And you both have to be certified in each of your fields. And in order to be for the entry-level positions for a creative arts therapist, you have to have at least a master's degree, which that's pretty cool because as far as I know, a CTRS, like I don't even think they have a master's degree for TR yet, or at least according to Sister Greenwood last year, that's what she told us. And so more about the master's degree, it's the entry level, and it has to be approved by the Department of Education, like every other degree. So this, okay, talking about the American Art Therapy Association, it supports the federal and state policies and initiatives that encourage, promote, and support efforts to gain a professional art therapy license and licensure of art therapists. And let me see here. So, and it says it represents more than 5,000 professional art therapists and others related to the art therapy profession who are dedicated to the belief that creative process involved in art making is healing and life enhancing. The association works in collaboration with its 40 chapters in 34 states across the country to enhance networking opportunities for art therapists, conduct community events, provide education opportunity, and promote community-wide communication services. And it wants to, their mission statement, I guess, they want to encourage the highest quality of art therapy. They want to facilitate communication among members and colleagues. And they're supporting legislative efforts by the state and federal levels. And they want to just give information to the general public, art therapists, and related mental health professionals. And they want to recognize excellence in clinical, professional, educational, and research activities. So this website, I just Googled the Art Therapy Association, and it came up. And there's just so much to their webpage. There's so much more information, and I could go on and on about it, but I'd rather not bore you, so I think I'll finish up there. But, alright, so that is my presentation. I hope you enjoyed it. I hope you learned a little bit of something about art therapy, and I really hope you enjoyed that video because I loved it. So, my sources are just on the next slide, but I hope you guys have a wonderful day, and see you later.